let's start with what's your mouth got to do with it? That was a catchy title that Jackie came up with, and I love that. And like I said, I had no idea how your mouth was connected to so many things, and this has been my entire life. So I am excited to share this information. This is the agenda of what we're going to talk about today. For people that don't know Jackie or me, we're going to introduce ourselves. Then we're going to talk about nasal hygiene, about mouth breathing, about tongue tie, and about tongue thrust. And these 4 topics only touch the surface of what can be going on in your mouth and how it affects your behavior, sleep, and so much more. So let's start with introducing Jackie. Do you want to introduce yourself, or do you want me
Yeah,
to?
I did that a little bit.
Already did.
But that's all right. We'll do it again. I'm the founder of No Problem Parenting, raising your kiddos with more confidence and less fear. You know, really what I do is I help you become the confident leader your kids crave you to be. They do. We don't have to be the expert in every area of parenting in order to be the expert of our kids. Right? Much like the expert or president of a company, they're the experts of their company, but they hire out for the things they're not experts in, but they are still overall the expert of their company. And so that's the same with parenting. And that's why when we don't know what we don't know, I bring in guests and resources to help us learn about those things that weren't on our radar before. So yeah, you can reach me at noproblemparents.com, but today is all about you, Sheree. So let's get to you.
Okay, so let's talk about me. So I'm a dental hygienist. I'm an oral myofunctional therapist. I'm the founder of the Healthy Mouth Movement. I have a podcast, a YouTube channel, and I just am so passionate about oral hygiene because this is stuff that I wish I had known. My daughter experienced bedwetting. They told me she would outgrow it. It became a social issue. She didn't want to spend the night at kids' houses. She had poor sleep. They told me she had ADHD. And as a mom, you have these like senses about your child. And I knew that she wasn't sleeping. It was a sleep problem. She had dark circles under her eyes. And you know how kids are when they're cranky, when they don't get enough sleep. So it just made sense to me that there was something else going on. And it took probably 6 doctors before I finally found someone who could help. So this is embarrassing. It affects the whole family, and these are all habits. And so if you can change a habit, you can change your life. And so I started out having issues with my mouth, which is how I ended up in the dental field. And then I went down this whole rabbit hole of how your mouth is connected to how you breathe, how you sleep, and whether or not you have a tongue tie. And Maslow's theory of hierarchy says that you need to have your basic needs met. And for me, it's being the owner of your health: oxygen, water, enough sleep, and getting the proper nutrition and respecting the one body we get. But it starts with our nose, because if you can't breathe, you need oxygen. If you don't have oxygen within 4 to 6 minutes, you can't survive. No matter if you're a human, an animal, whatever, you need to have oxygen. We were meant to breathe through our nose as humans. So that's where I feel we should start if we want to be healthy. And a lot of people just accept, I can't breathe through my nose, I'm congested. That's just the way that it is. It is for some people, but that is not normal. So there are a lot of things that I'm going to talk about today that are common, but it doesn't make them normal. And there is something that you can do about it. And we weren't trained in dental hygiene school as dentists about this information. It's not something that was in our curriculum. So not all providers will know about this stuff because we weren't taught it. So unless you experience this pain point as yourself, as a parent, you probably aren't going to know this information. So don't get upset if your providers don't know this information. So the nose is a sense organ. It allows you to breathe. It allows you to smell. It also allows you to taste, because a lot of things you can't taste if you can't smell them. And so air enters into our body through our nose, preferably. It warms, it filters, it moistens the air. It gets out all that debris and viruses before they go into your lungs. And it also shapes your appearance. So something that I didn't know, when you're a mouth breather and your mouth is open, all that air goes directly into your lungs, and your mouth is open, your tongue is down. When your tongue is down, it's not pressing up on the roof of your mouth, acting like a natural palatal expander, widening your arch. So when your tongue is down, as you grow as a child, it makes the arch more vaulted. The roof of your mouth is the floor of your nasal sinus. So if the roof of your mouth is shallower, your nasal passages are going to be shallower, making it more difficult for you to breathe. And most orthodontics tell you to wait till you're 7 or 8, conventional orthodontists. And a lot of doctors don't start with the nose. In the dental field, we don't talk about your nose. So oxygen, when you breathe through your nose, you get nitric oxide CO2 exchange. You get nitric oxide, which is vital for your body, for your cardiovascular system, for your immune system, for your respiratory system. It actually lowers your blood pressure. It creates better flow to your cells, to your brain. It helps you function better. When you breathe through your mouth, you get 18% less oxygen to your brain because you don't get that nitric oxide CO2 exchange. So something you should be looking for is nasal congestion and nasal hygiene. So I recommend nasal hygiene every day, whether it's taking a shower and blowing your nose, using a humidifier, keeping hydrated, a warm compress, a saline spray, or something called clear up your nose. I know a lot of doctors will introduce Flonase, but you can try all of these things before you get to that point with your kiddos, especially if they have a stuffy nose. I remember when we were little, when my daughter was little, we used that bulbous thing to suck all that stuff out. She hated that. So now there's saline drops and things that you can put in even when you change their diaper, just to help keep their nose clear so they can breathe better. So nasal hygiene is one of the first things that I recommend because it gets all that bacteria out so they can breathe better. And even if they have asthma or allergy symptoms, there are different breathing techniques you can do. So staying hydrated, drinking plenty of water. So we start with oxygen, water, and then we go to the correct nutrition. We're not going to get into nutrition because we're going to talk about mouth breathing and sleep. But again, you guys, we only get one body. And a lot of times, especially as parents, we don't put ourselves first. We don't take care of our body. We don't think that that's a good investment. But I had breast cancer, which is kind of why Jackie and I connected and then didn't. And what I learned through that whole experience is if you don't take care of yourself and you don't put your body first, your body will make you put yourself first. And then all that money that you thought you were saving and that you didn't think you had enough money for, you're now spending to get your health back. So we can start this with ourselves, but with our kids. So mouth breathing is one of them. So what I was taught was how toothbrushing was so important, and we need to brush our teeth twice a day. And if you're not brushing or flossing, you're going to get cavities. But going down this rabbit hole of trying to prevent cavities, which is the #1 preventable childhood disease, what I found was that when you're breathing through your mouth, it dries out all the tissues, it reduces your saliva, and that's what happens with cavities. You lower the pH, and when the pH drops below 6.5, the food that you feeds the plaque, which creates an acid, which is what causes cavities. So mouth breathing, if you have a whole family of kids, one child gets cavities, one child doesn't, it's probably a mouth breathing issue with that child or a reduced pH in the mouth. And we don't talk about this. Again, we weren't taught this. So this is why I teach all this stuff, because learning about mouth breathing is going to prevent a lot of other things. So this is the checklist that you can download. And these are signs to look for, and then facts that go along with that. So I'm not going to go too much into this, but dry, cracked lips, sitting with the open mouth posture. If they're sitting like forward like this, and that's going to be a sign that your child is having a mouth breathing issue. If they're having trouble with S's, with R's, if they're having a lot of nasal congestion, it could be that they have swollen adenoids. They could have swollen tonsils. And a lot of times your doctor will tell you your child will outgrow this stuff. They don't necessarily outgrow it. They grow into different problems that we're unaware of because our body compensates. So these are some of the symptoms that you can look for. If they're snoring, if they're clenching and grinding, if they're sleeping with their butt up in the air, if they're tossing and turning, their sheets are all messed up, their pillows end up on the floor, if they're kind of upside down, these are compensations that your body do in the middle of the night to wake you up to get more oxygen. And it's such a minute thing that we're not even noticing it, looking for it. And a lot of times kids are being diagnosed with ADHD, which is what my daughter was diagnosed with. She was bedwetting. We tried everything. We tried the thing that you lay on that wakes you up. We tried waking her up in the middle of the night. We tried not giving her fluids before bed. The only thing I didn't try was medications because I'm not a medication parent. I believe that it creates other side effects. And with this bedwetting medication, it dries up everything. It dries up your bladder, it dries up your nose, it dries up your mouth, it dries up your eyes. And that was just going to make the mouth situation worse. So I don't believe in medications, but everybody's different. There are many other pieces to the puzzle. You know, there's a lot of controversial things. With this comes mouth taping. There are some things, we're not going to talk about that today a whole lot, but people are taping their mouths. I don't recommend that for kids if you can't breathe through your nose. I don't recommend that for anyone if you can't breathe through your nose, but it is controversial, much like fluoride. People are for or against it. So there's all of these pieces to the puzzle: brushing, flossing, pH, breathing, diet, whether or not to use fluoride, visiting their dentist. When do you see your dentist? What is your doctor saying? So you can see that there's not just one thing. And I have been teaching people for years that if you're getting cavities, you must not be brushing or flossing. And if you're mouth breathing, there's nothing you can do about it. I now know that that is so far from the truth of everything that's going on. So am I going too fast?
I think you're okay. How about those watching right now? Is Sheree going too fast? You want to just put it in the chat? There's a lot of information and a lot more to get to. So I think it's good if you can kind of go through all of this and then we can come back.
Okay.
Yep, and ask questions.
So a little bit about diet. What happened in the Industrial Revolution? Our ancestors were hunter-gatherers. We got everything we needed from the land. They didn't have toothbrushes. They didn't have a lot of cavities. They didn't have crooked teeth. They were able to breathe and sleep better because our jaws were wider. Then comes the Industrial Revolution, where we now are growing our own foods. We're trying to make it so there's more food available. We have more softer foods, processed foods. Women went to work. Instead of nursing till the kids were 3 to 5 years old, we introduced bottles. When we nurse, you have this suck, swallow, breathe pattern, and your tongue goes up against the roof of your mouth. And as you grow and develop, it widens your arch. In the first year of development, you're 25% developed in your jaw. By the time you're age of 5, it's 70 to 80%. And then by the time you're age of 8, you're 85 to 90% already grown. So our diet changed our face. And when you use a bottle, you're sucking with different muscles. So you're using different muscle patterns. And when we used to have doulas, they used to have a fingernail that would cut that tongue tie and release it. And when we started going to hospitals to do more birthing, that was like a lost art. So we had this tongue tie. And we were taught we didn't even worry about the tongue tie. As long as you could stick your mouth out, you could latch without pain, and you didn't have a speech problem. But there's a posterior tongue tie that actually holds your tongue back and does a whole lot of different things. And we'll talk about that in a little bit. But all these things were lost in the Industrial Revolution. And so it changed our habits. It changed our health. It lowered our IQs. It shortened our attention span. And now we have a lot more breathing and sleep disorders. And it all starts with your tongue. So because our tongue was functioning differently, we were using different muscles, we're chewing and swallowing differently. So our tongue has taste buds on it. It helps us with textures of food, with tasting, with chewing, with swallowing, with speaking. And we put stuff in our mouth all day long. So our tongue is responsible for how our jaws and airway develop, which affects our breathing. Form follows function. So functioning with a bottle, prolonged pacifier use, sucking habits, these are all changing how our jaws are developing. Hence, our tongue now is blocking our airway when we're sleeping. We're smaller, our cheeks are creating more crowding because our tongue is not up, and it's affecting everything. And it's not something that we talk about a lot or that we even look at, not even in the dentistry field. So we want to understand what the function of the tongue is and what a vital role it plays in everything that we just talked about. It shapes our upper arch, and our upper arch is like a box on our lower arch. When our tongue is down, it pushes on those lower teeth, so then it pushes it out, and then those teeth come forward, which is called the crossbite. So if your teeth come over like a box, that's class 1, that's how it should be. But when your tongue is resting down and you grow and develop that way and the teeth come out, now it affects where your tongue is resting. And it should always be up on the roof of your mouth unless you're talking or speaking, because when your tongue is up, you can't breathe through your mouth. It forces you to breathe through your nose. Just try that as you're watching. Put your tongue up, try to breathe through your mouth. You can't do it. So that is why it's so important to have your tongue up on the roof of your mouth. And there's so many people that keep it down. We also want to clean our tongue because it's going to affect when you're mouth breathing, it's going to dry all that off, and it's going to affect cavities and gingivitis and all of that stuff too. So keeping your tongue clean and having it in the proper position is going to be really important. So now we're going to talk about tongue ties and tissue. And you can see there are 4 classifications of tongue tie. So this picture is an infant who is tongue tied. This infant is probably going to have a hard time latching. It's going to be painful for the mom. And this is usually what's released when they're first born. But a lot of times we're not looking for that. This is called ankyglossia, meaning that the tongue is tied to the floor of the mouth. And that's called a frenum. And a lot of times you can just take a laser and just clip that. When you're an infant, it's a lot easier because you don't have to do exercises before and after. You don't have to retrain the tongue. They just clip it. And within 2 or 3 days, it's healed. And the infant is none the wiser. It's harder for the parents than for the infant to have this done. So if you see your child like this, as soon as they're born, I would recommend getting a tongue tie release. And there's more to learn on this. This is just kind of simple, but we're going to talk about that. So that is a grade 4. So you can see in the lower right-hand corner, it's 25% tied to the floor of the mouth. They can't lift. And you can see in that picture of the adult, when they lift their tongue, it makes this little V or this little heart shaped. That person has low range of motion. And if you look at the space between the lower 2 front teeth, you can see that that attachment is pulling. So those 2 teeth are not coming together because of what's happening. So it's affecting the teeth. And if you look at the upper arch, you can see how narrow that arch is because the tongue wasn't resting up. And then if you go to grade 3, that's 50%. So if you open really wide and try to touch the tongue to the roof of your mouth, if you can't touch, this is a tongue tie. And you can see that frenum attachment pulling. And if you look behind, it actually is pulling from the floor of the mouth. So it creates compensations that are now affecting your chin, your jaw, your neck. So if you're getting headaches and you're feeling that pull, this can be related to a tongue tie. And then when you look at grade 2, that's 50 to 80%. A lot of the population fall into grade 2. They still can't get their tongue up, but they're compensating. So they can close down and their tongue can rest on the roof of their mouth. But you can still see, if you look at the teeth, even with braces on, there's not a lot of space for the tongue. So if she was able to get that tongue up, it probably wouldn't fit in there and it would spill over the arches. And then if you look at grade 1, that's being able to open as wide as you can and get your tongue up. And you can see when you look under the tongue, nothing is pulling there. So in grade 1 and grade 2, you can do exercises to be able to breathe better and put your tongue up. But you also may need the palate to be widened. And if you look at this stuff when kids are age 2 to 8, you can intervene and use their growth and development. But if you wait until they're 8 and above, a lot of times you need to crank that open and open those sutures to widen the palate so the tongue fits on the roof of the mouth. So this is why this is really important. And I was taught, as are most dentists and doctors, that you only need to worry about grade 4. So they'll tell you that you're not tongue-tied, when in essence you are, and you're compensating and you don't even realize how it's affecting you. And when that is tethered and pulling, it's connected all the way to your toes through fascia. So it pulls your posture forward. So if you sit forward or you lean forward, or even how your feet are, that's all related to your tongue. And so that's crazy to me, that how it affects the whole entire body, and we're not talking about it. So when your tongue is tied like that, if you can't move your tongue, sometimes you push forward. If you had a thumb sucking issue, if you used a pacifier for longer than over the age of 4, form follows function. So you could have opened that bite up with these habits, and now your tongue pushes through. So I'm going to show this short video of what happens when you tongue thrust. And so one of my mentors made this video and I took it off her YouTube channel. But you can see what your tongue does when you swallow. and why this affects your airway and your breathing. It also can affect your ability to bite and chew and bite foods. So there's an anterior open bite, there's lateral open bites, but it affects your teeth. Sometimes they're tipped in. And a lot of times, most of these people have a smaller palate. This is a class 2 where their teeth come over and they're overjet and the tongue comes through when she swallows. So these are all different classifications, but you can see how they might struggle breathing because now this is what their tongue is going to do at night when they sleep. And all of these things that happen when you're asleep is your body adjusting to you being able to swallow and breathe. So this is a class 3 where the lower teeth come in front, and you can see the lip tie there as well. So this is going to affect a person swallowing like this is going to swallow more air, probably have GERD, irritable bowel, a lot of gas because they're also swallowing air when they swallow. And we have them use those cheek protectors so you can see better, but it makes it harder for them to swallow when they can't put their lips together too. So that's a lateral. As you can see, it's only coming to one side. So that's unilateral. They're closed bite on the other side. But this person wore braces, and then the braces relapsed because of the tongue thrust habit. So if you don't address the habit, the braces are going to not work as well. So you see how the tongue is peeking through the side there when they swallow. And it's also pushing the teeth forward. And then you can see how the teeth are flared out because of the thrust issue. So I won't play that, but you can kind of get an idea of what's happening with the tongue and why this is a habit that needs to be corrected. So hopefully before you have braces, while you're doing braces, it can affect your speech and picky eaters, because a lot of times they're having a problem with taste, texture, with touch. My daughter had sensory issues. I didn't realize all this went along together. My niece, my daughter was constantly, my sister was constantly yelling at my niece to keep her lips closed and not smack her food. Now that I've become a myofunctional therapist, I realize the smacking is because she can't chew, swallow, and breathe at the same time. So this created these habits, and this is what was happening with her. And again, I feel like if I had known this information sooner, I probably could have helped her. She was put on ADHD medication. She now has severe anxiety, and I didn't want my daughter to go down that rabbit hole. So I went a different direction after watching what happened with my niece. But now I feel like I could have helped her. Uh-oh. I don't know what happened. Sorry about that. So does anyone have any comments? I can't read the chats. Do you have anything?
I'm not seeing anything so far. Does anybody have any questions you want to ask Sheree at this point?
Lots in the chat. So
I'm kind of highlighting some of the things you say. There's so many, so I can't highlight them all, but
there is. And I like to overwhelm people with information. I'm very good at that. So this is why our greatest wealth is our health. So because when you have these habits, you can see how it's a trickle down effect of how it is going to affect your breathing, your gut health, and inflammation. All this is going to cause inflammation in the body. So it's really important that we look at this stuff, especially for our kids. It's going to create a lifestyle and health behaviors. And I kind of just added these in here. So it's going to affect getting good sleep. So you can see with that tongue thrust, what is happening. So when you have that open mouth, now you're getting air in. So it's drying out your mouth. You're probably going to wake up with a headache, with a stuffy nose. So I was waking up with a stuffy nose and getting up and going to the bathroom thinking I had a bladder problem until they wanted me to go on medications, again, that stopped the bladder like they did my daughter. But I realized that it created all these other issues and I didn't want to do that. But I didn't realize that it was my mouth and my mouth breathing that was causing these issues. I was sleeping on my back. My tongue was blocking my airway. In my generation, they would take out premolars. So it closed me down even more. They don't do that as much with orthodontics now. They used to say there wasn't enough room for your teeth. Now they're widening your arch and making that room instead of taking out premolars and closing that space. So ideally for someone like me who's an adult, I need to wear braces again, open up those spaces, widen my airway so I can breathe better, and put in 4 implants. I don't want to do that at my age. I don't want to go through that. I'm watching some other people in this airway circle group that I follow go through that, and it's a lot. And so I think for me, it's not a big enough pain point. I have compensated with it. I've done it so long that I'm just doing what I can to combat the symptoms. But what I found, I now tape my mouth. I wear a night guard so I can get good sleep. Since I started taping my mouth, I can sleep 6 hours without even getting up and going to the bathroom at night. So getting good sleep has been a game changer. And until I experienced this myself, I didn't realize how important it was. And my mouth breathing was creating all of these issues that I was having. So how do we dream? What happens with sleep? So sleep runs in 90 to 110 minutes cycles. And there's 4 types of sleep. There's 3 cycles of non-REM sleep, and then there's a cycle of REM sleep, which is rapid eye movement, and that happens in a later stage of sleep. REM sleep is when you rest and repair, when your memory is set, when you have all the creativity, when you mouth breathe. So this is a picture of how a child should be sleeping with their lips closed. When you mouth breathe, what happens is you're always in fight or flight because you're not getting that nitric oxide CO2 exchange. You're not getting that oxygen to the brain. So our body wakes us up. It wakes us up with grinding our teeth, with snoring, with night terrors, with sleepwalking, with bedwetting. And what happens with bedwetting is bedwetters go into deep sleep faster, and their body just excretes what you don't need. So some people sweat and some people will wet the bed. Adults like me get up and go to the bathroom in the middle of the night. And if I don't go through these cycles of sleep, those are the nights that I wake up with night sweats. Again, because of my mouth breathing. Once I started taping, I didn't have these issues at all. And then I kind of watch what I eat before I go to bed at night. So when these things are happening and your body is waking up to compensate, it's now waking you up out of these cycles of sleep. And then, so that's why our kids are waking up still tired. They're waking up, they're bedwetting. They're waking up with dark circles under their eyes. They can't focus. They can't concentrate because they haven't had these circadian rhythm cycles of sleeps that they need to survive. And it's going underdiagnosed. So this is a sleep breathing disorder. So you can see in this picture, the normal breathing and then not normal. If your child is sleeping like this, they're probably gasping and then they're closing their mouth, or they're not necessarily waking up, but they're like, and then they're tossing and turning, they're gasping for air, but that's still kicking them back into stage 1 or 2 of sleep. So they may have dry, cracked lips. They may have open mouth posture during the day or at night. They may have crowded teeth. They may have speech difficulties. They may be snoring, and they're having these sleep disturbances that you're probably not even seeing because you're not in there, or they're having nasal congestion. It could create swollen adenoids and swollen tonsils because of the mouth breathing, because it's drying off all those tissues. And they could have more cavities or even puffy, swollen, bleeding gums because of all of this, all because of mouth breathing. So action items, things that you can do. You can evaluate your family. You can have them open really wide, look to see if they have a tongue tie. You can ask better questions. I didn't know to ask these questions. You can reach out to someone who is an airway provider, an airway dentist, an airway orthodontist, an ENT. A lot of times your ENT will tell you that it's not bad enough or they don't want to do surgery. So nasal hygiene can help shrink those adenoids. But if you have nasal congestion, you have open mouth posture, if you have a tongue tie, if you have a tongue thrust, these are all things that need to be addressed. And myofunctional therapy, these are the things that we look at. I do a free 15-minute consultation, then I do a $99 consultation, and then I do a full evaluation where I send you tools and things that you can do where we look at how you're chewing, how you're breathing. It's crazy how much is involved in this in an evaluation, but you can kind of look and see where you are and where your family is and all of these things. So the first action item is to just be aware and identify what's going on. So if you have any of these symptoms, if you have any questions, let's collaborate. Again, I have a 15-minute free consultation, just talk about what you have going on. And none of this information is medical advice. It's for education purposes only. I just want to put that out there. But this is all things that you should look for and address in your kids, especially if they're having some of these issues, or you see this, or they're having trouble breathing, because it could be connected. And for my daughter, just having that frenum attachment snipped, changing how she's breathing, changing her posture, doing some of these exercising, doing some sleep hygiene and nasal hygiene. She can sleep better. She can focus. She doesn't have those dark circles. I know she's not sleeping now when she gets those dark circles back. And again, wish I would have known this stuff.
All right. That was quick. That much, yeah, super quick. That's awesome. There's so much information in here. One of the questions, if anybody has questions, go ahead and put them in the chat. One of the things that comes to mind though, like I just cringe when I hear you say mouth taping. Because to me, I'm thinking, really? How would you, like, that would feel suffocating for me at night if I could. I think I would wake up if I wasn't able to open my mouth at all.
Well, and that's the problem. That's what I thought. I thought that, my nose was stuffy. There was no way I could breathe through it. Now I'm choking on, then this is what happens when you mouth breathe. So if you mouth breathe, you suck in air, and what happens is your saliva goes in your windpipe instead of down your throat. So this was happening to me a lot when I was working, especially during COVID and double mask. I didn't realize I was mouth breathing during the day.
I know, again, interesting enough when you had that year and a half to recover, to take care of yourself first, right? And to recover from your breast cancer. You're doing a lot of reading. And as you're doing this reading, you're like, oh my gosh, I'm doing this to help other people like my daughters and to understand more. And now it's me.
It's me. It's hereditary. And with my mom has sleep apnea. She stops breathing for 2 minutes. It scared my dad. She thought she was dead. Now I know that this is all hereditary. A tongue tie is hereditary. So if you have it, your mom or dad has it. One of your siblings has it. I'm treating a family now where all 3 of the little girls are tongue tied. And usually it's not everyone. So
one of the questions too that came in just real quick, I want to make sure to get to it, is, are your consultations virtual or in person? I know the answer.
They are virtual, just because I can reach more people. So I do some consultations in person if you're close to me, but most of them are virtual because a lot of this we can do online, and it's exercises that you can do. And, when I had cancer, I did a conscious breathing course because I was trying to just calm myself down. And again, you go down a rabbit hole with all of this stuff. And I was like, oh my goodness, I have this. My daughter has this. This is crazy. And so, yeah. And the mouth taping, when I first heard about it, I was like, you're crazy. I'm not going to do mouth taping. When I was going through my course, I said, I can't breathe. She's like, I'm telling you, you're getting up and going to the bathroom in the middle of the night. This all has to do with your mouth breathing, wanting to get a drink. I keep water next to the bed. So when I started mouth taping, I went this way so I could stick the straw in and get a drink.
Oh, okay. So what do you use? What do you use for mouth taping? Are you literally just using tape? Is it some sort of medical tape, or what are you doing?
It is specifically made for your mouth. So I like myotape. And I recommend the myotape for the kids. This is the smaller version. So it goes over your mouth like this. So I don't recommend for kids taping over their lips. And I don't recommend doing this during the night first. I recommend doing it during the day first. But I also, they have to breathe through their nose. So you have to do the 3-minute breathe through your nose test. So they can take a sip of water, keep their lips closed, hold the water in their mouth, and time them and see how long can they breathe through their nose without opening their mouth. So you might want to do some nasal hygiene first. You can also do an unblocking your nose test first. So you're going to take a deep breath in, pinch your nose, shake your head to the left and right, shake your head up and down. And when you feel that hunger for air, let go of your nose, keep your lips together. And interestingly enough, I like to watch people do this because when they let go of their nose, I like to see, do they take a breath in through their mouth? Because if they do, that's a sign that they're mouth breathing. So you want to be able to breathe through your nose, and this will unstuff your nose.
Wow.
So then I recommend doing the unstuff your nose, then take a sip of water. You can also put tape over their mouth during the day to see if they can breathe. So tape comes in all different shapes and sizes.
So I've done the nose clearing thing, now I put water in my mouth and I put this tape on my mouth and I'm supposed to hold it for 3 minutes.
Yes. So to see if you can breathe through your nose without swallowing.
For 3 whole minutes?
Well, because you should be able to breathe.
Well, right.
You're not holding your breath, but
right.
You want to be able to see, is your nose cleared enough to be able to breathe through it? Because if you can't breathe through your nose for 3 minutes, you need to see an ENT first. Why is your nose clogged? Do you have a deviated septum? Do you have swollen tonsils? Do you have swollen adenoids? Do you have a tumor, a polyp? Why are you not being able to breathe through your nose? That needs to be addressed first, because breathing is everything. And when you breathe through your nose, you get more oxygen. You're better. I mean, even athletes, they actually hire breathing coaches to breathe better. If you're a chronic mouth breather, you have a different posture. You look more like this. If you're a nasal breather and you grew up as a nasal breather, you look more like this. It changes our growth and development, how we hold our tongue.
Interesting. So now I have another question too, just because I'm currently experiencing this with COVID. It's been almost 2 years and I haven't had my smell. And I don't know if there's anything that now I'm literally going to do this because I feel like I can breathe fine through my nose. I don't think I'm a mouth breather. I don't have the tongue tie, any of that stuff. But they say that I've heard that there's inflammation in your nose from COVID that just, it's apparently not going away. So I'm curious.
Nasal hygiene will work. I like clear drops or just nasal hygiene with saline. This is for kids. You can put 1 drop up each nose. They also have a spray. I don't like the spray because it gives me too much. It's like a big rush and I can't control the amount that I put in. But this is called Clear. It has xylitol in it. So it will actually
Say that again. It has what?
Xylitol.
What is xylitol?
Xylitol is an artificial sweetener that comes from the center of a corn cob. And the Streptococcus mutans that cause cavities don't feed on this. So a girlfriend of mine wrote a book, Dirty Teeth Are Killing You. Her grandparents both died in a nursing home because they didn't get their teeth brushed. She started putting these xylitol drops up their nose and found out that it helped with aspiration pneumonia. Side note, but so the xylitol actually kills the bacteria.
Okay, gotcha. So she's so see, again, you talk so fast. The people that died, she wasn't putting that in their nose.
No, but no, people in the nursing home are dying from aspiration pneumonia from dirty teeth because they're not getting their teeth brushed. Nobody's brushing their teeth. They're getting this plaque buildup in there. The longer the plaque is in there, the nastier it gets. And what's happening is they're inhaling all of this bacteria. It's getting into their system. It's getting into their lungs and it's creating pneumonia.
Interesting.
Because they're mouth breathing.
I can relate to that in grandparents. Okay, so another question in here is, what is the best advice for nasal hygiene?
So the best advice for nasal hygiene, it kind of device. I don't know if I have one, but
I mean, there's neti pots and there's different variations of those.
It's going to depend on your personal preference. I put this in all of my kits because you can put saline in it and you have to put your nose down and just squirt it up your nose. A neti pot is good if you like that. I like this to clear that out. Sometimes you can just use warm water on the nose. If kids can't handle putting stuff up the nose, you can use that little sucker thing. And then I also get this little bulb syringe. I order these both on Amazon, and you can suck this out, or you can just put a little bit up the nose. You can control it with that. So the
idea is that when you do any of those, that it shoots it up, it's going to come out the other side.
And it comes out. Yep. But you don't want to tip your head to the side because it's going to go in the ear. You want to keep your head straight down.
Keep your head straight down so that it goes in and out. Yep.
Right. So what Dr. Zaghi and the Breathe Institute found is that parents, when they bottle feed and they lay their baby down, the fluid gets into the eustachian tubes because when they're sucking and swallowing and breathing. So he said once he started doing myofunctional therapy and breathing exercises, he didn't place tubes in the ears anymore because he started teaching parents how to feed better. So a lot of this stuff with infants starts with how you feed them. Are you nursing them? Are you bottle feeding them? Does the bottle fit their lips properly? So a lot of this stuff is really important in the first 1,000 days that your baby is born, how you're feeding them and looking at all of this stuff.
Oh, we could do a whole workshop just on feeding babies, couldn't we?
Making
sure that baby's turned in. It's okay if you're bottle feeding. There's no shame in bottle feeding.
Nope.
But think about where the baby would be if they're feeding from the breast. That's where you want your baby feeding from a bottle, and so they're a little bit propped up.
Yeah.
and then not turned outward either. They're able to put a hand on you maybe and get some skin, some touch, but also looking up at your eyes or up at your face, or the eye to eye contact. We're not staring at our babies all the time when we're feeding them. Hopefully you are in the first few months, especially, but do not be propping that baby out and plugging the bottle in. And then they're staring out to the universe. That's not good for bonding either, but also for digestion. It's not so great. So turning them towards you, making sure that you're looking at them and feeding them in a slightly upright position is much better for the baby. And it's okay if they want to hold on to that bottle themselves. Look at me go off on this now because I'm so passionate.
It's a whole nother another topic.
But we want to be holding that bottle as well up until, again, those first several months, even up to a year. If a baby's not letting you hold on the bottle, then you've got some attachment stuff going on, and that's a whole nother subject. They can call me for that one. But so there's that. And then there's another thing. So inflammation is really key to nose breathing.
Inflammation. Yeah.
And there are things we can do for that. What is your suggestion then? Is it typically to talk to you first, and then you can go through some of these signs and symptoms, or even if nobody ever calls you, you're going to want to talk to an ENT, make an appointment, not with your pediatrician, because the pediatrician's not going to be specifically able to help you with this. You may need a referral if that's what your insurance requires, but you're really going to want to go to an ENT, ear, nose, and throat specialist to learn more.
And preferably one that knows about airway, because again, right, all doctors are not created equal. So I am working with another family. And I met her on the plane, and I sat there looking at her kids the whole 3 hours on the plane thinking, do I say something? Do I not say something? And I finally said something. She was a physical therapist, and her ENT told her that her daughter was fine. A week after I saw her on the plane, she saw a different ENT and had her adenoids removed. And she said her breathing is like night and day.
Right. Okay. And talking a little bit about the myofacial. I see another question in here. Is it myofacial?
It's oral facial myofunctional therapy. It's
myofunctional. That's different.
Myofunctional.
Right. Different than myofacial, because there's a question here about how can we know if we're getting a good professional for myofacial therapy? Is that helping as well?
So myofacial is releasing the fascia. So some myofunctional therapists can do that as well. It's like we keep getting more information so we can help more people, because we just didn't realize how all this was connected. So myofunctional therapy addresses the function, the tongue function. So myofunctional therapy really has 4 goals: lips together, breathe through your nose, tongue on the roof of your mouth, and correct swallow pattern. So we disassociate the tongue with everything else, so it functions separately from all the other muscles of your face and neck. And how you develop as a child will determine how that is functioning and how you're breathing. And so, yes, there's no shame in bottle feeding, but the bottle needs to fit the baby so their tongue is doing what it needs to do. And so those are 2 different aspects, orofacial and oral myofunctional therapy, because that's the muscles. So we retrain the muscles of the face. So when I do an evaluation, I look at, what are your eyes doing? Can you wink? Is one side built out more than the other? Is one muscle built out more than the other? Because then we will do different exercises to build that out. So that's why I can't just put people in a class, because everybody's different in how they're functioning. And so the treatment has to be specific to what you have going on in your mouth.
Gotcha. Hope that makes perfect sense. I'm also I didn't do this before, and I know we had a couple people that had to go out because of work. And so let me put your links in the chat as well for ways that people can get a hold of you and learn more, and just even watch. You put out a lot of it. Your LinkedIn site is wonderful. I guess that's maybe where I follow you most, but you have a lot of videos put out on there to help people kind of determine if this is something that they should be looking into more for their kids or family. And then of course you offer your free consultation to if you can't help, you can give resources. But
and I have a Facebook group. I have a free Facebook group. You can follow me to learn more. I kind of put the same thing on the Facebook group that I'm putting in the LinkedIn, but I go live once a week, and I call it Check Up from the Neck Up. And so I talk about different things that people have sent in and want to talk about. So I go live every Thursday in that group to talk about different things.
Yes, perfect. So if your kiddo is bedwetting, if they're a picky eater or a problem feeder, they're having problem, if they have speech challenges, if they're nonverbal, And you're thinking, wow, they're two, they should be talking now. They should be saying more to, this is a good thing to rule out, if nothing else, right? We can rule these things out. If you, the adult, are having issues with snoring and tossing and turning at night, this is another great thing to check into for yourself. Like you mentioned, as an adult, you may not want to go to some of the extremes that are, treatment needs, but there are other things that you can do as an adult to help you breathe better. That is different than breathing, regular meditation or breathing techniques.
Yes.
That, like you said, you can go down a rabbit hole with all of those kinds of things.
Yeah.
I find it really interesting that just how this relates and how it sticks with us throughout. Obviously, you can grow up having this and do just fine.
Right. Because your body is amazing at compensating.
Yeah. But there are much easier ways. And where I love this, and I've already referred a couple of people to you just since learning about all of this, is these younger kids that are being diagnosed with things that really aren't necessarily related, like behavioral diagnoses, when really this is more physical.
Mm-hmm. Yes. Yes.
Yeah. And there's a lot more that we can do. So a kiddo that isn't breathing well, isn't sleeping well, a kiddo who isn't sleeping well, isn't behaving well during the day. And that, we can have all the behavior mod techniques in the world, but that's not getting to the root of the issue. And again, here at No Problem Parenting, step one, seek first to understand, why is my child behaving the way they're behaving? And this is a really key, like, I just want this to be your resources on our resource page. People can go to noproblemparents.com and check out Sheree's information is on there as well. And your podcast episode, you were on the podcast episode 144. If they want to learn more, they can hear about all the things that we covered on the podcast, which I think we touched on most of those today too. But there are just so many things that we can prevent so much hardship in the long run, going down the rabbit hole of, like you said, meditation or different breathing or occupational therapy, physical therapy, diagnosing, mental health, all of the things that could be prevented if we start from the beginning with the breath, with breathing, and how are we doing with that? So definitely incorporating this into my coaching program to make sure we rule that out. So that parents really can. And thank you, everybody. If you have to go, you go ahead and jump off. We really appreciate your joining us today. You will get a replay of this you're going to get the link to watch this and get all of the notes, and the PDF. Of course, there was a link for the PDF. For those of you that registered, you're going to get the replay, and we'll probably do an encore presentation of this. Sheree, I'm even thinking periodically, we might want to just do little snippets and have just specific information on the effects of correcting the mouth breathing issue and how that can help, like you said, bedwetting, the picky eating, the speech issues, behavior, hyperactivity, all of that kind of stuff. So I'm just very thankful that you joined me today and you were willing to do this event in the first place. We are definitely gonna be connecting much more because it's just such a valuable, it was not on my radar at all.
Mine either.
Yeah. And you were in the industry for 35 years.
And I think that's still mind blowing to me, is that I didn't know any of this information. And even the place that I work now, they don't look at this stuff.
Right.
It's just like, that's just one more thing. We don't have time for that. So they let me talk about it, but the doctor won't come in and say yes. So how people are, it's like, I'm not the doctor, but if the doctor comes in and says it, so it's just getting awareness. People have to hear things 7 times before it registers. And, some people just look at me like, yeah, no, I don't think so.
Well, and I also think it's important. The slideshow the slide that you had about the 4 different types of tongue tie, or the 4 different, well, not types of tongue tie, because number 1 is that you don't have one at all. But number 4, what did you call the number 4 one again?
I call it class 4, 25%.
Yeah, class 4. So I think, and this just happened to a family that I met with a week or so ago, one of their kiddos has the class 4. So the docs were like, yep, that's tongue tie. Their other child is likely in the class 3. We're not sure yet. I've referred them to you. We'll get that checked out. But the docs kind of said, no, we're not worried and we're not concerned with that because it wasn't the class 4 type. And that's just not okay. because in, even if it is class 3 or class 2, there are things that we can do to help that child. And again, seeking first to understand, getting to the root of what the issue is.
Well, and another thing I didn't talk about with the tongue tie and myofunctional therapy is you don't want to just release that. And you want someone that's going to go a little bit deeper, because if you don't do exercises before and after, it will reattach.
Well, there you go. See, there you go. And people who have had braces on their kiddos, and then a year or 2, 3 years later, they're having to do it again. You just covered some of that in today's workshop. And so I would be, if I spent the money on getting braces on my kiddo, and then heard from, the orthopeds that, it may come back, or their teeth may, go back to where they were, I would be saying, hey, wait, have you heard of this? And if not, I'd be finding somebody that has, so that we're not, spending the money to get the same end result, a few years
2 or
later.
3 times.
Yeah, right. Which I didn't. I mean, I know people who have had that issue. And so it's like, hey, maybe there's something more to this, and that opening of the mouth and just all of the stuff. I mean, there's just such great information here. So, yep, I know some people are popping off. We are going to wrap it up, Sheree. I have all the links in the chat for your information, how people can get a hold of you. And again, we'll be partnering up. I'm sure I will see you soon. Thanks so much for being with us today.
Thanks for having me. It was awesome. Thanks for letting me share this information.